to Asian Gallery. Today's our guest is Dr. Zainul Abideen. Dr. Abid is the head of Pediatric Oncology at Burjeel Medical City in Abu Dhabi. He is a native of Matul village in Kerala. Doctor and his team was in news recently for treating a 5-year-old girl from Uganda. It was a landmark treatment in the history of UAE. Doctor is also planning to release a book called Cancer in Children, What Parents Need to Know. So we are going to ask some questions about this book and his experience as a pediatric oncologist. Welcome to Asian Light Gallery, Doctor. So what do you want to achieve through this book?
First of all, thank you very much, Asian Light team, for this opportunity. This book is, as the name say, childhood cancer, children cancer, what parents need to know. As you may know, going through the cancer treatment, it is a very difficult journey, not only for the children, but also for the parents. To make their journey easy, educating parents are very important. We need to educate various aspects of childhood cancer and what are the scenarios they might face during the cancer treatment. So that education will make them less anxious, less worried, and educated parents monitor children very well during the treatment, and they trust us and they follow up doctor's advice very well. So all these things clearly proved with evidence that at the end, outcome of treatment in childhood cancer is improved when the parents are educated and empowered. And this book is all about educating, empowering parents about childhood cancer.
Which are the languages you are planning to publish this book?
3 years back, I first published in Malayalam, that is my mother tongue, and which gave me a lot of positive feedback. Therefore, second edition was published 2 years back in Sharjah International Book Festival. So in this September, I am going to release third edition of Childhood Cancer in Malayalam, in Kerala. And same time, I also thought I would publish same book in English as well as Arabic, because currently I work in UAE. Therefore, this year I am releasing third edition in Malayalam and first edition of the book in English as well as in Arabic.
Congratulations, Doctor. So it's quite amazing you are releasing book to help parents. What is the reason for choosing pediatric oncology?
As you may know, cancer treatment is considered to be challenging not only for the patient, parents, as well as for medical professionals. Professionally and personally, I like kind of challenging job, and when I do challenging job and I succeed in that job, I get a lot of satisfaction. So in the past, I like this kind of job. So I thought in medical profession, I should go for cancer treatment specialization. Therefore, I choose pediatric oncology because I was originally a pediatrician. So going through the training as well as working in a well-organized system in the UK, and I've been treating several children with cancer, I realized that this is one of the best specialization suitable for my nature, because treating children with cancer is really challenging. You have to face children as well as whole family when they go through this difficult journey of cancer treatment. At the same time, cure rate of childhood cancer internationally are at the best with current available treatment. One of the commonest cancer in children, acute lymphoblastic leukemia, with currently available treatment, we can cure 90% of them. So that give me a lot of satisfaction. So, so I think over the years, having treated many children, having cured many children with cancer, I really realize that the the specialization I choose is the best, and I am getting a lot of satisfaction because of this.
You got an opportunity to work in the UK, India, and in the UAE. Is there any fixed pattern for the treatment plan?
Well, if you go through the treatment history of childhood cancer, you can understand 40 to 50 years back, most of the children with cancer are not treatable in children. However, over the years, based on the research and protocol-based treatment, outcome of children cancer treatment has improved. One of the main reason for this success is pediatric oncologists in general follow protocol-based treatment. That is at the best in the UK. UK, the NHS system, I worked in NHS for more than 15 years. And I believe NHS is one of the best healthcare system in the world, where treatment is delivered depends on the need of the patient, irrespective of that they have money or they have insurance or not. Moreover, to develop highly advanced medical care in the UAE. Therefore, I joined in VPS Healthcare, and with support of Dr. Shamsher and other management team in the Burjil Medical City, we have developed a very good team to set up pediatric bone marrow transplantation in Burjil Medical City. And fortunately, we have done successfully bone marrow transplantation in a 5-year-old girl with sickle cell disease for the first time in the UAE, and the child is doing very well at the moment. I felt looking back, this is one of my achievement I have made in my professional career.
Congratulations, doctor. So, do you have any future plans?
Definitely, I think we are planning to expand our bone marrow transplantation program, and Dr. Shamsher always is supportive and inspiring to bring highly advanced medical care to the UAE. So, in the next few years, we are also in the process of developing highly advanced bone marrow transplantation program like CAR T cell therapy, even up to gene therapy. We are also thinking and planning to expand our bone marrow transplantation program under VPS Healthcare to we are also planning to expand our pediatric bone marrow transplantation program under VPS Healthcare in India as well as other Gulf countries.
Excellent. You are a busy doctor. How do you manage your work life balance?
Well, I think, of course, relaxation is very important, especially when you work in a challenging situation, when you handle very challenging, stressful situation like cancer treatment. Of course, I do relax and I believe in relaxing in between this kind of job. What I do usually is I am interested in agriculture and farming and looking after pets. That was my childhood hobby, and I continue this hobby even in the desert, and I have a farm in the desert. So I go there over the weekend and I involve in agriculture and plantation and looking after pets. So that gave me a lot of relaxation, and I also take my family, my wife also very much keen on all these things, and we work together as a family in the field, and we get a lot of relaxation and enjoyment over the weekend.
What about your family?
My wife is a obstetric consultant in Cornish Hospital, and she has got special interest in fetal medicine. I have 3 children. The eldest girl, currently she's studying for medicine in Plymouth University. She's in second year. Other 2 boys studying in British School of Al Kubairat, Abu Dhabi.
Okay, the last question. What's your advice to the new gen medical practitioners?
Yes, I started medicine in Calicut Medical College, and I did my school from a village, and I got an opportunity to work with many consultant, very experienced doctors in UK as well as in UAE and in India. And I've been working in medical field for more than 25 years. So what I learned over the years, and what 2-3 advice if you ask me to give new generation, the first thing is, if you want to be a good doctor, you need to listen to your patient. If you are a pediatrician, you need to listen to your patient parents. That will give you a lot of information. And other thing is, you need to seek help from your colleagues or from other professionals if you don't know what is happening with the patient, or if you are not sure. Definitely, this will minimize the chance of missing diagnosis. Another advice I like to give is, you need to educate your patient about the disease, or you need to educate your patient parents, if you are a pediatrician, about the disease. That will empower them to monitor themselves, and that will help them to follow your advice very well. The other thing I would like to stress here is, patient is patient, or parents are parents if you are a pediatrician. They are not trained to be a patient. However, we as a doctors, we are trained in medical school to become a doctor. So you may face difficult situation when you face the patient or parents. They may be anxious, they may be angry with you. However, you are a doctor, you are a trained person. You have to behave as a trained person. That will improve the trust, that will improve the relationship between you and your patient or parents if you are a pediatrician.
Thank you, doctor. Thanks for sharing your experience with Asian Light. Thank you.